"Get out, you dumb rookie," the surgeon shouted loud enough to stain the whole trauma bay with shame. And then a wounded Navy SEAL commander did something nobody could explain. He fought through blood pain and pride, and he saluted her like she outranked every person in the room. If you've ever been the one talked down to, blamed for one small mistake, or told to step aside while everyone watches, this story hits a nerve. Midnight in Virginia Beach. The air outside is wet and cold. The floors gleam under harsh lights. Monitors scream, and a single vial rolls across tile like a verdict. Casey Morgan stands frozen, wearing wrinkled scrubs and a borrowed name, trying to stay invisible in a place that never lets you breathe. Stay with me. By the end, you'll know how real courage looks under pressure, and why the quietest people can be the most dangerous. Don't click away, like the video, and comment where you're watching from. That salute did not come from nowhere. It was not a stunt, not a gesture made for drama. It was the end of a chain reaction that had been building for hours inside a place that never forgives weakness, not even the kind that comes from exhaustion. Sentinel Shore Medical Center sat a few miles from the Atlantic, close enough that the air carried salt into the parking garage and left a thin grit on the glass doors. Outside, Virginia Beach was slick with winter rain. Streetlights blurred into long yellow smears on the pavement, and the wind kept worrying at the ambulance bay doors like it wanted inside. The hospital did not care. It stayed bright and sterile and awake, humming with fluorescent light and the constant restless breathing of machines. Casey Morgan moved through that light like she had learned how to live in it without letting it get into her skin. Her scrubs were the color of faded slate, wrinkled from a shift that had stretched too long. Her hair was pulled into a practical knot at the base of her skull, not for style, but for speed. She wore no jewelry except a simple watch with a scratched face and a second hand that swept too smoothly, as if time in this building had been sanded down and made sharp. Her badge said Casey Morgan, RN. The letters looked clean. The plastic looked new. The lanyard did not. It was frayed where fingers had worried it when the world went quiet in the wrong way. The clip had a tiny dent like it had been squeezed too hard. People noticed scrubs and badges. People did not notice fraying. People did not notice the way a person's eyes always found the nearest exit before they found a chair. Casey did that without thinking. Every doorway, every corner mirror, every line of sight down a corridor. She did not stare. She did not make it obvious. It was the smallest flick of her gaze, fast enough that it looked like she was simply checking a monitor or glancing for a coworker. But it was always the same pattern. It was always the same math. In Trauma Bay 2, the monitors had a high, impatient voice. A steady heart rhythm, a pulse oximeter chirp, a blood pressure cuff inflating and releasing like a slow squeeze around a wrist. The air smelled of antiseptic and damp fabric from wet coats tossed over chairs. A single overhead vent breathed cold air over the gurney, making the sheet ripple slightly at the edge. Casey stood at the medication cart, checking labels with hands that did not shake. She looked like the new girl, only if you believed what the badge told you and what the others needed you to be. People liked their worlds simple. They liked titles. They liked to know who was allowed to speak and who was supposed to nod. In this department, it was easy for a nurse to become background noise, especially a nurse who did not laugh too loud and did not share too much and did not complain when she got the worst assignments. Casey did not complain. She did not ask for favors. She did not correct anyone when they called her rookie with a grin that did not reach their eyes. She just worked. And she worked like someone who knew that a small mistake could turn into a body bag if the wrong moment caught you tired. A door down the hall swung open and slapped lightly against its stopper. A burst of voices spilled out, then died as quickly as it came. The emergency department was full, but it had pockets of sudden quiet, the kind of quiet that formed right before a storm. Denise Alvarez stepped into Trauma Bay 2 with a clipboard held to her chest like a shield. She was the charge nurse on night's mid-40s, hair streaked with early gray that she did not bother coloring. She had the posture of someone who had learned how to take up space without apologizing for it. Her eyes flicked over Casey's cart. "You stocked morphine?" Denise asked. Casey did not look up. "Yes." "Antibiotics?" "Yes." "Extra pressure dressings?" Casey met her gaze for half a second. "Top drawer, left side." Denise's mouth tightened, almost approving, almost tired. "You've been in this unit 2 weeks," Denise said. "You move like you have been here 2 years." Casey's expression stayed neutral. "I read fast." Denise snorted softly. She leaned closer, lowered her voice, and that was the first time Casey heard a warning in it. "Stay out of Dr. Sloane's orbit tonight." Casey's fingers paused on a vial. "I'm always out of his orbit." Denise's eyes sharpened. "He decides who's in it. He's hunting." Casey's hand resumed its steady motion. "For what?" "For someone to blame," Denise said. "For someone to remind everyone that he runs this room." A burst of laughter sounded from the nurse's station, thin and brittle. It faded into the steady din of alarms and overhead calls. Denise glanced toward the glass wall that faced the main trauma corridor. "He's been in a mood since day shift." Casey did not ask why. The why did not matter. Men like Sloane always had a reason ready. Pressure, protocol, standards, excellence. They would call cruelty a necessary tool and wear it like a badge. Denise's voice softened just a fraction. "You're doing fine. Keep your head down. Get through the night." Casey gave a single nod that could have meant anything. Denise left her shoes squeaking once on the tile, and the bay settled back into its mechanical breathing. Casey continued labeling syringes. Across the unit, Dr. Victor Sloane's voice carried like a siren. It was not shouting yet. It was the kind of loud that told everyone he could shout whenever he wanted. Sloane was a senior surgeon with a reputation that had become legend in the hospital. Some people called him brilliant. Some people called him a tyrant. Most people called him doctor and did not add anything else. He walked fast, as if the hallways owed him room. His hair was silver at the temples, his jaw clean-shaven, his eyes pale and cold. He wore confidence like armor, and he used his voice like a weapon. Casey saw him through the glass as he stopped a first-year resident near Trauma Bay 1. The resident, a young man with tired eyes and a stethoscope still too shiny, held a chart and looked like he wished he could disappear into it. Sloane pointed at the chart without taking it. "You missed the allergy history," Sloane said. The resident's cheeks flushed. "I was waiting on the family, sir." Sloane's smile was thin. "Waiting is what people do when they are afraid of making decisions. I made the decision to stabilize first," the resident said, voice too eager. Sloane leaned closer, and even through glass, Casey could see the resident's shoulders tighten. "If you want to be mediocre," Sloane said, "go work urgent care." The resident swallowed. A nurse nearby kept her eyes on a monitor as if it was the most fascinating thing in the world. Casey looked away before Sloane's gaze could drift. Keeping your head down did not mean being weak. It meant understanding the shape of danger. The night moved in waves. A fall with a hip fracture. A teenager with an asthma attack that had him clawing at his chest, eyes wide with fear. A drunk man yelling at everyone until a security guard guided him to a quieter room with a practiced patience that said he had done it 1,000 times. Around 1 in the morning, a car accident rolled in. The patient was a woman in her 30s, blood on her forehead, eyes glassy. She kept asking for her phone like her phone was a life raft. Trauma. Bay. 2 filled with people. Gloved hands. Rapid questions. The smell of blood and antiseptic mixing into something metallic. Casey took the woman's hand and spoke close to her ear. "Look at me," Casey said. "You're in the hospital. You're safe." The woman blinked, mouth trembling. "My kid. We're checking everything." Casey said, voice steady. "Stay with me." She moved smoothly, placing a blood pressure cuff, checking pupils, watching the monitors as if the numbers were a language she had learned before she learned English. The resident called out vitals with a voice that cracked once, then steadied. Someone asked for an IV start. Someone asked for labs. The room swelled with sound. Sloane stepped in like he owned the air. "What do we have?" The resident began speaking quickly, stumbling over words. Sloane cut in. "Airway," Patton Casey said. Sloane glanced at her, not expecting her voice. Casey did not look away. "Breathing. Shallow, but present," Casey said. "Oxygen saturation dropping. She's guarding." Sloane's eyes narrowed. He hated being helped by someone he had not chosen. Circulation. Casey's hands were already on the patient's wrist. Pulses fast. Skin cool. Pressure is trending down. Sloane looked at the monitor, then back at Casey. His mouth tightened as if he had tasted something bitter. "Too large bore," he snapped. "Type and cross." The room obeyed him. Casey continued working, giving information when it mattered, not when it would draw attention. She kept her voice low. She never raised it. She never begged to be heard. And somehow that made her harder to ignore. When the woman stabilized, the room, drained of people leaving behind used gauze-torn packaging and the faint smell of adrenaline that lingered like smoke. The resident wiped sweat from his brow and avoided looking at Sloane. Sloane lingered a moment, scanning the bay like a general inspecting troops. His gaze landed on Casey again. It was quick, sharp assessing. Casey turned toward the supply shelf and began restocking without waiting for direction. Sloane watched for another beat, then left his steps clipped. Denise returned with a fresh set of orders and a look that said she had heard every word through the glass. "You kept her alive," Denise murmured. Casey's hands moved over the shelf, arranging saline bags by size. "The team did." Denise studied her. "He hates that you don't get rattled." Casey did not answer. Denise lowered her voice further. "He hates anyone who makes him feel replaceable." Casey slid a box of gloves into place. "Then he should try being kinder." Denise gave a tired laugh that held no humor. "Kindness doesn't get you tenure." Casey met her eyes. "It gets you loyalty." Denise's expression shifted just slightly, as if something in her wanted to agree, but was too exhausted to let it out. "Just keep your head down," Denise said again. "Please." Casey nodded once. Denise left. Casey stood alone in the bay for a moment, listening to the building. Hospitals had their own sound. A constant hum under the alarms. The low rumble of HVAC. The squeak of wheels. Distant voices. Somewhere far away a baby cried. Somewhere closer someone laughed too loud and then stopped as if they remembered where they were. Casey's phone vibrated in her pocket. One buzz, then silence. She did not take it out. She did not like unknown numbers. She did not like surprises. She did not like anything that threatened the thin wall she had built between this life and the other one. Her fingers brushed the edge of her badge through the fabric of her scrub top. The plastic was smooth. The name felt like a costume. Casey Morgan. She had learned to answer to it. She had learned to sign it. She had learned to say it without flinching. But sometimes, usually at night, when the hospital was quiet enough for memory to creep in, she could feel another name hovering just behind her teeth like a ghost trying to speak. She pushed it down and returned to the medication cart. A lull settled over the trauma unit, the kind of pause that never lasted. Nurses took sips of cold coffee. Residents leaned against counters, eyes heavy. The winter rain rattled softly against the ambulance bay doors. Casey lined up vials on the cart, checking expiration dates, counting doses. Routine work. Grounding work. The kind that kept your mind from wandering into places that smelled like dust and burning metal. A tech hurried past behind her, carrying a stack of linens. The tech's elbow brushed the side of the cart. It was not hard, it was not malicious. Just careless, the way people got when their bodies were tired, but the work did not stop. The cart wobbled. Casey's hand shot out not to catch the cart, but to steady the top tray. She did it with a reflex that was too fast, too precise, too practiced. One vial slipped free. It struck tile with a tiny click and began to roll. The sound was not loud. It should have been nothing. In the fluorescent quiet, it became enormous. The vial rolled in a straight line, spinning, catching light, turning slowly as if the floor itself wanted everyone to watch. Casey's eyes went to it, then to the hallway, then back to the vial. Anyone watching might have thought she was deciding whether to grab it. Anyone watching closely would have noticed the order. Hallway first. Exit lines. Sound sources. Then the object. Her throat tightened. Not because of the vial. Because she heard something else. It was faint, almost buried under the hospital noise. A rhythm of footsteps that did not match the usual hurried shuffle of staff. Heavier. More deliberate. A cadence that carried training. Boots. Not the soft soles of nurses. Not the squeak of clogs. Boots that struck the floor with controlled force. She heard a radio chirp in the distance. Short, coded, professional. Her body went still. The vial kept rolling. Across the bay, someone laughed at something on a phone, then shut it off as if the air changed. The resident at the desk glanced up confused, sensing a shift he could not name. Casey's fingers flexed once a tiny motion. Her gaze fixed on the corridor. A shadow crossed the glass. Denise stepped into view, her head turning toward the entrance, her mouth parting slightly as if she had just heard the same thing. Then, Dr. Victor Sloane's voice cut through everything. He had appeared without warning, as if he had been waiting for a mistake to rise to the surface. His eyes snapped to the rolling vial. His jaw tightened. His lips drew back not in a smile, but in a baring of teeth. He did not look at the tech who had bumped the cart. He did not look at the system that kept people running until their brains softened at the edges. He looked at Casey. Because Casey was new. Because Casey was quiet. Because Casey did not have allies who would risk his wrath. Sloane stepped closer, close enough that Casey could smell his aftershave under the antiseptic. "What is that?" he said, pointing at the vial like it had offended him personally. Casey's voice stayed calm. A vial. It slipped when the cart moved. Sloane's nostrils flared. "And you let it roll." "I'm retrieving it," Casey said. Sloane's eyes narrowed further, taking her measured tone as disrespect. "No," he said. "What you're doing is contaminating medication because you're careless." Casey's gaze went again to the hallway. The boots were closer now. The radio chirp came again, sharper. Sloane saw her glance and mistook it for guilt. He raised his voice, making sure the whole unit heard him. "Get out," he said. The words hit the room like a thrown object. Nurses turned their heads. Residents went still. Even the tech who bumped the cart froze, eyes wide. Casey stood very straight. Sloane's face flushed with righteous anger, the kind people put on when they want their cruelty to look justified. He took one more step toward her, and this time he did not lower his voice. "Get out," he repeated louder. The vial rolled to a stop near the base of a cabinet, glinting under the lights like evidence. Casey's eyes dropped to it for the briefest moment, then lifted back to Sloane. The room waited. Sloane wanted begging. He wanted apology. He wanted to see her collapse into the role he had assigned her. Casey did not give him any of it. Her face stayed blank, but there was something behind her eyes that did not belong in a civilian trauma bay. Something sealed away and awake. Sloane's mouth curled. He delivered the line like he had been saving it. "Get out," he roared, "you dumb rookie." Every sound in the room fell away around the words. Casey did not move, not because she was defiant, because the boots had reached the door. Because the air at the entrance had changed, thickened, as if the hallway itself carried weight now. The trauma bay doors hissed as the latch released. Then they slammed open hard enough to rattle the glass. Two uniformed security personnel stepped in first, scanning corners with a precision that did not belong in a hospital. A combat medic followed, pushing a gurney fast, its wheels clattering a steady, urgent rhythm. On the gurney was a man propped upright, his face pale beneath a controlled mask of pain, one hand wrapped in gauze, dark with blood, the other pressed against a fresh wound beneath his shoulder. He was not loud. He did not need to be. The room recognized authority the way bodies recognize heat. Dr. Sloane's posture changed instantly. His anger snapped into a smooth professional mask as if someone had flipped a switch. He strode forward, voice turning polished. Commander Sloane said, already reaching for control. Casey took one quiet step back, then another, obeying the order without giving Sloane the satisfaction of a reaction. She kept her eyes level, her hands at her sides, her pulse steady in her throat. The gurney rolled deeper into the bay. The wounded commander turned his head slightly as if responding to a sound that only he could hear. His gaze traveled across the room. It found Casey, and it locked on her face. The wounded commander did not blink. He held Casey in his gaze as if the rest of the room had faded into static. His pupils tightened, then widened again, a small involuntary tell that something inside him had shifted from present tense into memory. The gurney rolled another foot forward and stopped when the combat medic set the brakes. The medic's gloved hands stayed on the rails, ready to move again at a moment's notice. 2 Navy security personnel took positions without being told, one by the door, one near the wall angled so he could see the hallway and the bay at the same time. Their eyes did not drift. Their heads moved in short measured arcs. Dr. Victor Sloan saw the uniforms and the rank and adjusted like a man changing masks in one breath. His shoulders squared. His voice warmed. The earlier roar vanished so completely it might have belonged to someone else. Commander Rourke Sloan said, stepping to the head of the gurney, "We're going to get you squared away." Rourke did not answer. Sloan reached for the sheet as if touching it made him in command. Vitals, he snapped, then softened it into a performance of efficiency. "Let's keep it calm in here. This is straightforward." The combat medic spoke in clipped phrases. Graze wound under left shoulder. Dressing is holding but bleeding through. Right hand laceration with possible fracture. No loss of consciousness. He insisted on staying upright. Sloan nodded along, already building the story he wanted to tell himself. He leaned in, peered at the shoulder dressing, then looked up with a practiced confidence. "Pain level?" Sloan asked. Rourke's eyes stayed on Casey. Casey stood near the medication cart, one step back from where she had been, her arms relaxed at her sides. She kept her face still, but her body had gone into a kind of quiet readiness. She felt the way the room had changed. She felt it the way you feel pressure shift before a storm. Sloan followed the line of Rourke's gaze and finally noticed where it landed. His expression tightened. He turned, extended a finger past the gurney, and pointed directly at Casey as if she were a problem that needed removing before he could continue the important work. "Get her out of here," he said. The words were sharp again, surgical steel, not loud this time, but absolute. He gestured toward Navy security as if they were hospital orderlies. "We have military personnel to treat." One of the security men glanced at Sloan, then at the combat medic, then back to Rourke. He did not move. The other security man did not move either. Their stillness did not look like defiance. It looked like they were waiting for the only voice that mattered. Sloan did not notice. He was too used to being obeyed. Now, Sloan added a slight lift in volume to remind the room who owned the bay. Casey did what she had trained herself to do in 1,000 small moments of discomfort. She complied without feeding the cruelty. She stepped back again, calm and silent, her gaze level. She did not argue. She did not explain. She did not plead. It was not submission, it was precision. Her eyes flicked once to the rolling vial that had stopped near the cabinet. Then they lifted back to neutral space, not quite meeting anyone's gaze. Sloan watched her retreat, and his jaw clenched as if her calm was an insult. Rourke's breathing changed. It was subtle, a slight tightening in his chest, as if a band had been drawn across his ribs. His fingers flexed once on the gurney rail. The combat medic noticed and leaned in, ready to steady him. Rourke lifted his chin a fraction, and his eyes sharpened not with pain, but with a focused recognition that looked almost like disbelief. He moved his head slowly, deliberately, never breaking his gaze from Casey. Then his posture shifted. His spine straightened against the pain. The movement cost him. You could see it in the tension at the corner of his mouth and the faint tremor in his shoulders. But he did it anyway, as if his body was obeying a rule older than injury. He raised his right hand. His fingers trembled from blood loss and strain. The motion was not casual. It was formal, precise, drilled into muscle memory until it became instinct. He saluted. It was a full, clean salute, the kind reserved for officers and operators who have earned something you cannot buy. The trauma bay went silent in a way that felt unnatural, like sound had been swallowed. A nurse at the far counter froze with a syringe halfway in the air. A resident who had been typing stopped and stared at the screen without seeing it. Even the monitor alarms seemed to recede, not because they stopped, but because nobody's brain could hold on to them. Casey did not move. Her face stayed blank, but her eyes tightened slightly. The smallest tell that something inside her had been struck. She held herself still, as if she knew any reaction would invite questions she could not afford. Sloane's face drained of color. He leaned toward Rourke, confused and suddenly careful. "Sir Sloane," said, voice dropping, "why are you saluting her?" Rourke did not look at him. He kept his gaze pinned to Casey like an anchor. "Because you just ordered a war hero out of your trauma bay," Rourke said. The words were calm, almost quiet, and that quiet carried more weight than shouting ever could. Sloane's mouth opened, then closed. His eyes flicked to Casey, then away, as if looking at her too long might burn. One of the residents swallowed audibly. Someone in the hallway paused outside the glass, drawn by the stillness. Sloane tried to reclaim his footing. "Commander, I think there's been a misunderstanding. She is new to the department." Rourke's expression did not change. "I did not ask how long she has worked here," Rourke said. "I asked you to stop treating her like she is disposable." Sloane blinked, startled by being corrected in his own kingdom. Casey stood near the edge of the bay, where Sloane had pushed her, her posture deceptively calm. She did not look proud. She looked tired in a bone-deep way that had nothing to do with the long shift. Rourke's salute lowered slowly. He kept his eyes on Casey. "They told us you were dead," he said. The sentence landed in the room like a dropped instrument, heavy and impossible to ignore. Casey's throat moved once in a swallow. She did not speak. The skin around her eyes tightened, then smoothed again as she forced her face into stillness. Sloane stared at her as if she had committed a crime by existing. A nurse near the door whispered barely audible, "What?" Denise Alvarez appeared in the glass doorway, drawn by the shift. She took in the scene in one glance. Rourke, upright on the gurney. Sloane, pale. Casey backed away. Navy security posted like statues. Denise's eyes widened, then narrowed her expression, turning into something protective. "Commander," one of the Navy security men said quietly, stepping a fraction forward. "We need to get you stabilized, sir." Rourke did not blink. "I am stable," he said, then nodded toward Casey without breaking eye contact. "She is the one you should be listening to." Sloane snapped back into indignation. "With all due respect, this is a civilian hospital. That nurse is brand new. She dropped medication. She is not cleared for." He stopped because Casey moved. She did not move toward Rourke. She moved toward the vial. She crouched smoothly, retrieved it, and wiped it down with an alcohol pad in one clean, practiced motion. She placed it back on the tray with a quiet click that sounded final. There was something in that simple action that spoke louder than any argument. It said she had heard the insult. It said she had absorbed it. It said she had chosen work over spectacle. A resident near the desk let out a nervous laugh that died immediately when nobody joined. Rourke's eyes never left Casey. "Mr. Sloane," Rourke said, reading the name from his badge without looking at it directly. "You are loud. That is usually how insecure people compensate." A sharp inhale cut through the room. Sloane's face flushed crimson. "I am trying to save his life," he snapped, then corrected himself as if he could rewind. "Your life, Commander." Rourke tilted his head slightly. "I am not dying." Casey spoke, then her voice low and controlled. "He is not dying," she said. Every head turned toward her. It was not defiance. It was clinical. Gray's wound. Casey continued, eyes flicking briefly to the shoulder dressing. "Painful, not lethal. Irrigation, prophylactic antibiotics, pressure dressing. His hand needs imaging." Sloane scoffed. "And you know that because..." Casey did not bother finishing the exchange. She stepped directly to the gurney and addressed Rourke as if Sloane did not exist. "Stay still," she said. "You are bleeding through the dressing." Rourke obeyed. That obedience settled over the room like a verdict. It was not that patients did not listen to nurses. They did. It was that a man like Rourke did not listen to anyone unless he had decided they had earned it. Casey's fingers moved with practiced efficiency as she checked the dressing, her touch precise and restrained. She did not coddle. She did not hesitate. She worked as if she had done this under worse light, with worse noise, with worse consequences. The combat medic watched her hands, and his eyes narrowed slightly, measuring. Sloan stepped closer, desperate to regain control of his bay. "All right," Sloan said sharply. "That is enough. Nurse Morgan, step back. I will handle this." Casey did not look at him. She kept working. Sloan's ego did what egos do when they lose. It reached for force. He grabbed her wrist, not hard enough to leave immediate bruises, hard enough to claim ownership. "I said, step back," he hissed. Casey's hand went still for a fraction of a second. Her face did not change, but her shoulders tightened, a small instinctive response to being restrained. Rourke's head lifted. His eyes went flat. "Take your hand off her," he said. The words were barely above a whisper. They landed like a rifle shot. Sloan froze mid-grip. His fingers loosened as if the skin under them had become hot. For a moment, nobody moved. The room held its breath and waited to see what kind of man Sloan was when power stopped working. Sloan released Casey's wrist slowly. He tried to recover with a laugh that did not sound like laughter. "Commander, I was just—" No, Rourke cut him off cleanly. "You do not get to explain this away." Rourke looked at Casey again, and his expression shifted. Less anger now. More grief, deeper and older. "My team does not lose people," he said softly. "Not once. Not a single operator." The phrase carried weight. The combat medic's jaw tightened. One of the security men glanced at the other. Denise took a small step forward, eyes fixed on Casey. Casey's hands resumed their motion, finishing the dressing with a calm that looked impossible. "That team is gone," Casey said, voice flat. Rourke's laugh was hollow. That is what they told the world. He leaned forward on the gurney, pain flaring across his face, and pushed through it anyway. "But I was there," he said. "I saw you in the dust, with your hands inside a man's chest cavity, telling him to keep breathing like you were giving orders to the universe." Casey's throat constricted. It was visible. She taped the dressing with 2 firm strips and stepped back, putting a fraction of space between herself and Rourke. "You need rest," she said. "Stop talking." Rourke ignored the instruction, not out of disrespect, but out of urgency that lived behind his eyes. Denise entered the bay fully now, clipboard still in hand. "What is happening here?" she demanded, though her voice was cautious now, aware that something larger had entered her building. Sloan lunged at the opening like a drowning man grabbing air. "This rookie is interfering with—" Rourke turned his head and cut through the argument without raising his voice. "Get me your hospital director," he said. Denise blinked. "Sir, we do not typically—" Now Rourke repeated. The word was not loud. It was pure authority. Denise hesitated, then moved. Her feet carried her out of the bay with the speed of someone who had learned when to stop debating and start acting. Casey watched her go and felt a familiar cold settle under her ribs. Recognition in public was not a compliment. It was exposure. Sloan swallowed hard, his earlier arrogance cracking into panic. "Commander," he tried again, voice coated in synthetic warmth. "We are under pressure. Our staff is exhausted." There was confusion. Rourke did not give him eye contact. He watched Casey instead, as if he was making sure she stayed where he could see her. One of the Navy security men shifted his stance, subtly blocking the exit. Casey noticed. Of course she noticed. Her gaze did not flicker, but her body registered the change in angles. The way the doorway was now narrower. The way movement options had been reduced. Sloan noticed too, and it frightened him. He turned to Casey, attempting a new tactic, softer and more controlling. "Nurse Morgan," he said, using her last name like a leash. "Tell the commander you are new here. Tell him you were careless." Casey looked at him for the first time in a direct way. Her eyes were calm, and that calm made his voice falter. She did not answer. Rourke's gaze sharpened. "Did you drop it because you are careless?" he asked Casey. The question was simple. The room felt the trap in it. Casey's eyes moved once subtle toward the hallway where footsteps approached. Suits this time, not boots. The scent of expensive cologne drifted in before the men themselves appeared. Administrator Martin Keene entered the bay with the careful posture of someone stepping into danger while pretending it was routine. His suit was tailored, his tie perfectly straight, his smile assembled for crisis. Behind him came Denise, her face tight, and another supervisor with an anxious stare. Keen's eyes landed on the gurney, then the uniforms, then Casey, then Sloane's flushed face. He took a breath as if to assume control. Commander Rourke Keene said, palms lifting in a pacifying gesture. "We appreciate your service. We are committed to providing the best care, but this is a civilian facility. We have protocols in place." Rourke's attention finally shifted to Keene. He looked at him the way a man looks at paperwork that has tried to kill people. "You are correct," Rourke said. "You have protocols." Keene nodded, quickly relieved by the initial agreement. Rourke continued, "And your protocols just allowed a senior physician to put his hands on a nurse in front of witnesses." Keene's smile faltered. Sloane's face twitched. Keene turned to Sloane as if trying to find an explanation that would keep him safe. "Dr. Sloane." "I was correcting insubordination," Sloane said quickly. She was interfering. Rourke's eyes narrowed. "She prevented you from performing incompetence." Keene blinked. Denise's mouth tightened. A resident near the wall stared at the floor, wishing he could erase himself. Sloane tried to regain the ground by pointing back to the vial. "She dropped medication. She is demonstrably careless." Rourke's gaze snapped back to Casey, and now the question returned heavier. "Did you drop it because you are careless," he asked again, "or because you were monitoring the room?" Keene's eyes darted to Casey, then to the Navy security men, trying to understand what kind of game he had stepped into. Casey looked at Sloane, then at Keene, then at Denise. Finally, she spoke, her voice quiet enough that people had to lean in to hear it. "I heard boots that do not belong in a hospital," she said. "I heard radios. I knew someone significant was incoming." The bay hardened into silence. Keene's lips parted. No words came. Sloane stared at her as if she had betrayed him by telling the truth. Rourke nodded once, slow like a hypothesis confirmed. "Exactly," he said. He shifted, preparing to stand. The combat medic moved instinctively to steady him. "Sir, you should not." Rourke stood anyway. The movement cost him. Pain flared across his face, and for a second his eyes closed. Then they opened again, sharp and controlled. He took one step, then another, until he was close enough to Keene that Keene had to tilt his head back slightly. Rourke's presence filled the space. "I am requesting a military medical consult," he said. Keene swallowed. "A consult?" "Yes," Rourke said. Keene's eyes flicked to Denise, searching for help. Denise's expression said she had none to offer. Sloane's eyes widened with comprehension and dread. "Commander, that is not necessary. We can handle this." Rourke did not look at him. "I am not asking if you can," Rourke said to Keene. "I am informing you that I am." Keene's professional mask tightened. "Commander, with respect, we do not take orders from military personnel. Our hospital is governed by—" Rourke cut him off with a calm that felt colder than anger. "You will take this request," he said, "because it concerns active duty personnel and a credible threat." Keene's posture stiffened. Threat. Rourke did not elaborate. He did not need to. The uniforms in the room carried the implication. The wound on his shoulder carried it. The way his security detail had posted themselves carried it. Rourke continued, voice steady. "And I am attaching Nurse Casey Morgan to that consult." Casey's breath caught. She kept her face still, but her chest tightened as if someone had pulled a strap across her ribs. Keene's eyes widened. "Commander, she is a civilian employee. This is not—" "It is," Rourke said. Sloane stepped forward, unable to stop himself. "This is insane. She is a rookie nurse." Rourke turned his head just enough to include Sloane in his vision. "You keep using that word like it protects you," Rourke said. "It does not." Sloane's mouth opened, then closed. Keene's gaze shifted between them, recalculating. Denise stepped closer to Casey, not touching her, but positioning her body in a protective way. Her voice was low. "Casey," Denise said, "talk to me. Who is he?" Casey did not answer. Her eyes were on Rourke, and the look in them was not fear. It was a complicated restraint, like a door held shut with both hands. Keene tried again, softer. "Nurse Morgan, are you willing to participate in this?" Casey's throat worked. She kept her voice even. "I am on shift," she said. Keene blinked, thrown by the simplicity. Rourke's eyes held hers. "You're coming with me." Casey's jaw tightened. You do not get to want things. One of the Navy security men moved a fraction as if ready to intervene, but Rourke lifted his hand slightly and he stopped. Rourke's voice lowered not for the room but for Casey. "Those recruits are going to die without what you know," he said. Casey's eyes flicked away for the first time toward the floor, toward the cabinet, toward the vial, toward anything that was not the truth in his face. She inhaled slowly through her nose, steadying herself. Keen's phone buzzed in his pocket. He fumbled it out, answered in a clipped whisper, listened, then went paler. He lowered the phone and looked at Denise. "Director Hargrove is on her way down." Denise nodded once, eyes still on Casey. Sloan seized the moment, turning toward Keen as if returning to familiar territory. "We need to focus on care. Commander Rourke requires surgical assessment. We cannot let this become a spectacle." Rourke looked at him. This time he gave him full attention and Sloan visibly shrank under it. "You touched her," Rourke said. Sloan lifted his hand slightly. "I was preventing interference." Rourke's voice stayed quiet. "You were asserting control." Sloan's face flushed again. "This is my trauma bay." Rourke's expression did not change. "No, this is a room where people bleed. Your ego does not get to be the loudest thing in it." Keen shifted his weight clearly, wanting to leave the bay to stand behind a desk where words could keep him safe. Denise's voice cut in sharp. "Dr. Sloan, go write your note." Sloan stared at her, shocked by the directive. Denise held his gaze. Now, Sloan's lips pressed together. For a moment it looked like he might explode. Then he turned away abruptly, jaw clenched, and strode to the workstation with stiff, angry steps. The moment he moved, the bay seemed to breathe again. Rourke swayed slightly. The combat medic stepped in close, but not touching unless needed. "Sir, you need imaging." Rourke nodded once, eyes never leaving Casey. Casey stepped toward the gurney, not because she wanted to, but because the work in front of her demanded it. She checked the shoulder dressing again, then looked at the medic. "Any numbness in the hand?" she asked. The medic answered immediately. He says no. Grip is weaker. Casey nodded. "We need X-ray, possibly CT if there is joint involvement." Rourke watched her hands. "You are still doing it," he murmured low enough that only she heard. Casey did not respond. Denise leaned in. "Radiology is ready. We can move him now." Keen returned to a brittle professionalism. "Commander, we will comply with imaging and consult request pending director review." Rourke's eyes flicked to Keen. "You will comply now." Keen swallowed and nodded. The gurney rolled out of Trauma Bay 2. Navy security moved with it, one leading, one trailing. The combat medic kept a hand on the rail. Casey walked beside the gurney. Her steps controlled her gaze, scanning intersections. She felt eyes on her from every angle. Nurses who had ignored her now watched her like she had become a different person mid-shift. Residents stared as if the floor had tilted. Sloan stood at the workstation, fingers white on the keyboard, watching her leave with a look that was part humiliation, part fury, part disbelief. Denise walked close to Casey, voice barely audible. "If you need me to stop this, say so." Casey's throat tightened. She did not know what stopping it looked like anymore. They reached the imaging corridor, aggressively bright, the light draining color from everything living. The air smelled different here, colder, more chemical. The walls were too clean. The quiet was wrong, like it belonged to machines, not people. Rourke shifted on the gurney and caught Casey's sleeve gently with his uninjured hand. Not pulling, not forcing, just anchoring. Casey looked down at his fingers, then up at his face. His voice was low. "Ava," he said, and the name did not belong in this hallway. Casey's breath caught so sharply it hurt. Denise's eyes widened. Keen's head snapped toward them. The combat medic's gaze sharpened. Casey's lips parted, then closed again. Her voice came out controlled, almost flat. "My name is Casey," she said. Rourke held her gaze without flinching. His grip on her sleeve tightened just a fraction. The Navy security man at the front paused as a radio chirped in his ear. He touched the earpiece, listened, then stepped back toward Rourke and Casey. "Ma'am," he said, eyes on Casey, tone respectful and unyielding. "The base is dispatching transport." Casey's stomach tightened into a hard knot. The security man continued, voice steady, as if reporting weather. Estimated arrival 10 minutes. The words 10 minutes did not sound like time. They sounded like a lock turning. The imaging corridor was a long white throat that swallowed noise. Fluorescent panels buzzed overhead, bright enough to bleach color out of faces. The air was colder here, drier, stripped of the antiseptic sting that clung to Trauma Bay 2. Casey walked beside the gurney, with her hands close to her sides, careful not to touch anything that did not need touching. Her eyes kept moving, not openly, not dramatically, just the smallest controlled sweeps that mapped doorways and corners and reflective surfaces. Rourke watched her the way a marksman watches wind. Easy, the combat medic murmured, leaning close to Rourke. You are bleeding through again. Rourke barely nodded. His fingers stayed on Casey's sleeve for another beat, then released, as if he had proven to himself that she was solid, that she could not vanish by accident. Denise Alvarez kept pace on Casey's other side. She looked like she wanted to ask 100 questions, but knew the hallway was full of ears. Administrator Martin Keene trailed behind them, phone pressed to his palm like a lifeline, his polished calm cracking at the edges. A radiology tech pushed open the CT room door. "We are ready," she said, voice too bright, too normal for what was happening. Inside the CT suite was aggressively clean. A flat table, a circular scanner like a pale mechanical mouth, cabinets with sealed drawers. Everything smelled of plastic and cold metal. The only sound was the faint whir of equipment and the distant hum of the building. The gurney rolled in. The medic and tech transferred Rourke with practiced efficiency. Rourke gritted his teeth once when his shoulder shifted, then smoothed his expression immediately, as if pain was an inconvenience he refused to acknowledge in public. Keene stepped in after them, then hesitated like he had crossed into restricted territory. Navy security remained in the doorway, bodies angled outward, eyes on the hall. Their presence made the room feel smaller. Denise moved toward Casey, low and firm. "Do you want me to pull you out of this?" she asked, barely moving her lips. Casey did not answer. Her gaze was on Rourke, stressing on the way blood had started to darken the gauze again at one corner. A simple problem, a solvable problem. Her hands itched with the need to fix it, because fixing was safer than speaking. The radiology tech looked between them. "Sir, we need you to lie flat." Rourke's eyes did not leave Casey. "In a minute." Keene cleared his throat. "Commander Hospital Director Hargrove is on her way. We will address the consult request through proper channels." Rourke finally looked at him. The glance was not angry. It was colder than anger, the kind of calm that did not need volume. "You are not in charge of the clock," Rourke said. Keene's mouth tightened. "We are still responsible for this facility." Rourke's voice stayed even. "Then be responsible." Denise put a hand on Keene's sleeve, a subtle warning. Martin stepped back. Keene looked offended for a heartbeat, then obeyed, not because he respected Denise, but because he could feel that the room had shifted away from him. Casey took one step closer to the CT table. "Let me replace the dressing," she said to Rourke. Rourke's expression changed in a way only Casey seemed to notice. The hard edges softened by a fraction, like relief trying not to show itself. "Do it," he said. Sloane's voice appeared from the doorway like a stain. "Absolutely not." Dr. Victor Sloane stood at the threshold, white coat, crisp jaw set, eyes bright with indignation. He had followed them down like a man chasing his stolen authority. "That is my patient," Sloane said, stepping into the room. "This is a hospital. We do not run field medicine and radiology." Denise turned on him. "You need to leave." Sloane ignored her. His focus stayed on Casey as if she were the source of every problem tonight. "You are not cleared," he said to Casey. "You are a nurse. You are new. You will step away." Casey looked at his hand. The same hand that had grabbed her wrist, then looked up at his face. She said nothing. She did not have to. The silence itself made Sloane's nostrils flare. Rourke shifted on the CT table, a slow, deliberate movement. "Sloane," he said quietly. Sloane straightened as if hearing his name from Rourke restored him. Sir, I am trying to protect your care. Rourke's eyes went flat again. You are trying to protect your ego. Sloane's face reddened. With all due respect, Commander, you are not familiar with our protocols. Rourke leaned forward slightly, testing the pain like a man testing a blade. With all due respect, Doctor, you put your hands on a nurse in front of witnesses. Sloane opened his mouth, then shut it again. A flicker of calculation crossed his face. He glanced at Keene as if expecting rescue. Keene stared back suddenly, fascinated by the floor. Denise's voice cut in low and sharp. Victor, go back to Trauma Bay 2. Sloane's eyes flashed. Denise, you do not get to order me. Denise did not blink. Tonight I do. Rourke's gaze returned to Casey. Replace the dressing, he said, as if the argument had already ended. Casey reached for gloves. Her hands stayed steady, but inside her chest something was tightening. Not panic. Something older, a pressure that came when control started to slip away. She opened a sterile pack, peeled the gauze back carefully. Blood seeped along the edge, dark and slow. She did not rush. She did not hesitate. She cleaned the skin around the graze, checked for swelling, checked the direction of the wound track with her eyes and fingertips. Rourke watched her hands. His breathing slowed as if the act of watching brought him into a steadier rhythm. You should not be here, he murmured so quietly that only Casey heard it. Casey kept her eyes on the wound. Neither should you. Rourke's mouth twitched once, not quite a smile. Fair. Sloane made a disgusted sound. This is ridiculous. Casey's voice stayed level. Hold still. Rourke obeyed again. The radiology tech stood frozen, unsure whether to intervene. Navy security remained at the door like statues carved from restraint. Keene's phone buzzed again. He glanced down, then up. Director Hargrove is on the elevator. Denise nodded once. Her eyes stayed on Sloane. Good. Casey secured the new dressing, pressed it firm, then taped it down with clean, deliberate strips. When she finished, she stepped back half a pace. Her gloves were spotted. She stripped them off and disposed of them without drama. Rourke exhaled slowly. Thank you. Casey did not answer. Gratitude felt dangerous. Gratitude made things personal. Personal made things stick. Sloane took a step forward, voice hard. Commander, this cannot continue. She is interfering with care. She dropped medication. She created a contamination risk. Rourke turned his head slightly. You are still talking about a vial. It is a serious issue, Sloane insisted. Rourke's eyes narrowed. You used that vial to humiliate her. Sloane's jaw clenched. I used it to enforce standards. Rourke's gaze flicked to Casey again. Standards do not require cruelty. Sloane's mouth tightened into a thin line. You do not understand what it takes to run a trauma bay. Rourke's voice dropped. I understand what it takes to keep people alive when the world is falling apart. Casey felt that sentence land in her ribs like a quiet impact. She kept her face still. She focused on the CT table, on the scanner, on the easy instruction the tech had not yet been allowed to give. Sir, the radiology tech said, finally gathering courage, we need you to lie flat so we can scan your shoulder. Rourke nodded. Do it. As the tech prepared, Rourke's eyes stayed on Casey. His gaze had the weight of a hand placed gently on a door to keep it from closing. Keene tried to insert himself again, voice professionally mild. Commander, about the military consult request. You are asking to attach a civilian nurse to military transport. That is not a small matter. Rourke's attention moved to Keene with glacial patience. You keep treating this like a preference. It is a legal issue, Keene said. We have liability. Consent, employment contracts. If she leaves her shift under duress, the hospital could be exposed. Denise's eyes narrowed. Martin stopped. Keene did not stop. Fear made him talk. We do not know who she is. We do not know what she is involved in. We cannot simply allow armed personnel to remove staff. Rourke listened without interruption. Then he spoke, voice steady enough to make the room go quiet again. Someone tried to kill me, he said. The sentence was simple. It changed the air. Keene's expression faltered. Sloane's eyes widened. The radiology tech froze with a hand hovering near control. Denise did not look surprised exactly. She looked like she was finally seeing the outline of the shape that had been hiding behind the night. Rourke continued. I am alive because the trajectory was off by 2 inches. He did not raise his voice. He did not dramatize it. He said it like a report. Sloane recovered first quickly, too quickly. Commander, that is terrible, but it has nothing to do with this hospital's staffing. Rourke's eyes flicked to him. It has everything to do with the people who were trained to keep me alive. Sloane started to speak. Rourke cut him off with a look. Keene swallowed. Do you have evidence, he asked, trying to anchor himself to procedure. Rourke's gaze returned to Casey. I have enough, he said. Casey felt the floor tilt slightly under her, not physically, but in the sense that a line had been crossed. Someone had spoken the kind of truth that could not be put back in a folder. Casey kept her eyes on the scanner. She forced her breathing to stay calm. In through the nose, out through the mouth, quiet, controlled. Rourke's voice softened by a fraction aimed at her now. You know what it looks like when training fails. Casey's throat tightened. She did not respond. Sloane scoffed, trying to inject contempt back into the room. This is all very dramatic. Denise snapped. Victor, shut up. Sloane turned on her. Do not speak to me that way. Denise stepped closer, her clipboard held like a shield. You grabbed her wrist. Sloane's eyes flashed. I corrected her. Denise's voice went colder. You put your hands on staff. You do it often enough that people stop calling it out. Tonight, you did it in front of Navy security. Keene's eyes darted between them. He looked like he wanted to vanish through the wall. The CT scanner hummed to life. The radiology tech began the scan, hands moving with careful professionalism, grateful for the refuge of a task. Director Hargrove entered the CT room with 2 administrators behind her. She was in her late 50s, hair pulled into a neat twist, eyes sharp enough to cut through performance. She did not waste time. Her gaze swept the room once. Navy security, combat medic, commander on the table. Sloane, rigid with resentment. Keene, pale and sweating. Denise, braced like a guard dog. Casey, quiet near the side, hands clasped loosely, face unreadable. Commander Rourke Hargrove said, voice steady. I am Evelyn Hargrove, Hospital Director. You requested me. Rourke shifted his head slightly to look at her. Yes. Hargrove nodded. My administrator tells me you are requesting a military consult and you want a member of my staff attached to it. Yes, Rourke said. Hargrove glanced at Casey, Nurse Morgan. Casey met her eyes. A calm stare, no apology. Hargrove's gaze returned to Rourke. This is a civilian facility. We do not provide personnel to the military without clear documentation and consent. If there is a threat, I will cooperate with law enforcement. But I cannot allow my staff to be pressured. Rourke listened. Then he said, I am not pressuring her. Hargrove's eyes narrowed slightly. She looks pressured. Casey's jaw tightened. She kept her mouth shut. Rourke's voice lowered, calm, controlled. Then ask her. Hargrove turned fully to Casey. Are you consenting to this? The room held its breath. Casey felt every eye on her skin. Felt Denise beside her like an anchor. Felt Sloane's stare like a blade. Felt Keene's anxious hope that she would say no and restore his world. Felt Navy security at the door, silent and watching. Rourke's gaze stayed on her steady and unblinking. Casey opened her mouth, then closed it. Consent was a clean word. It sounded like choice. It sounded like control. Casey had learned long ago that sometimes choice came wrapped in consequences so heavy it did not feel like choice at all. Her voice came out quiet. I'm on shift. Hargrove's expression tightened. That is not an answer. Casey forced herself to look at Hargrove, not at Rourke. I cannot be attached to anything military. Sloane's lips pressed together, satisfaction flickering. Rourke did not move. His voice stayed low. You can. Casey's eyes hardened. You do not get to decide what I can do. Hargrove lifted a hand. Commander, This is exactly what I mean. Rourke turned his head to Hargrove, again expression controlled. Director, my recruits freeze when blood hits the floor. They are strong, fast, intelligent, and they lock up in the moment that matters. That is why my team leader was nearly killed. Sloane snorted. That is not a hospital problem. Rourke's eyes snapped to him. You should not speak. Sloane's face flushed. This is my department. Denise stepped forward. Not tonight. Hargrove's eyes flicked to Denise. Denise. Denise's voice was steady. He grabbed her wrist. Hargrove's gaze went to Sloane. Is that true? Sloane straightened. I restrained her because she was interfering. Hargrove's eyes did not soften. We will address that after the commander is stable. Keene opened his mouth as if to add something. Hargrove cut him off with a glance. Martin. Keene shut it. Rourke's voice returned to Casey softer, almost private, even in a room full of people. They told me you were dead. Casey felt something twist in her chest, a sudden sharp pull. She did not let it reach her face. That is not my problem, she said. Rourke watched her for a long moment, then said, You are still scanning exits. The sentence was quiet. It hit like a confession. Casey's fingers curled, then relaxed again. Habit. Rourke's eyes stayed fixed, not a nursing habit. Hargrove looked between them. Commander, who do you believe Nurse Morgan is? Rourke did not answer immediately. The CT scanner hummed as it completed a pass. The radiology tech avoided eye contact, focused on her screen like it could protect her from history. Rourke spoke finally. She is the reason people lived. Sloane made a harsh sound. This is absurd. Hargrove's eyes stayed on Rourke. Do you have documentation? Rourke's jaw tightened. If I had documentation, she would already be back where she belongs. Casey's voice cut in low and sharp. Do not say that. Rourke's gaze did not waver. Then tell them to stop dying because nobody taught them what you know. Hargrove's expression shifted into something more cautious, more strategic. Commander, if there is a credible threat against you, and if you believe this nurse is connected to it, then law enforcement needs to be involved. Rourke's voice stayed calm. Law enforcement moves too slow. Hargrove's eyes narrowed. That is not your decision. Rourke looked at her. It is when the threat is inside a chain of command that does not answer to you. Keene swallowed hard. Denise's eyes flicked to Casey, a silent question in them. Casey did not answer it. Hargrove's face stayed composed, but her attention sharpened. Commander, I will not allow my staff to be removed without consent. If Nurse Morgan chooses to leave, that is her choice. If she chooses to remain, that is the end of this. Rourke nodded once as if accepting the rule. Then his gaze returned to Casey. Casey felt the weight of it. The way the room seemed to narrow down until it was just her and that look. She forced her voice to stay even. I choose to remain. The words tasted like metal. Rourke did not react the way Keene expected. There was no anger, no threat, just a slow inhale and an exhale that sounded like restraint. Then I will make the request official, Rourke said. Hargrove's eyes narrowed. How? Rourke glanced toward the Navy security man at the door. A tiny nod. The security man stepped forward, earpiece crackling softly. He spoke with quiet precision. Director Base Transport has been dispatched under consult authority. Arrival in 8 minutes. Keene's face went gray. You cannot just do that. Hargrove's jaw tightened. On whose authorization? The security man replied Naval Medical Command. Hargrove held his gaze. I will need documentation. You will receive it, he said. Hargrove turned to Rourke. Commander, you are overriding my facility. Rourke's voice was steady. I am protecting mine. Casey felt Denise's presence beside her, warm and steady. Denise leaned close and whispered, If you want me to stop them, I will. Casey stared at the CT machine, at the smooth, white curve of it, at how clean everything was compared to the memories trying to crawl up her spine. She whispered back, You cannot stop this. Denise's eyes tightened. You do not know that. Casey looked at her, then really looked. Denise's face held stubborn care. It held anger on Casey's behalf. It held the kind of loyalty Denise had said mattered. Casey's voice came out quiet. If I fight it here, it gets uglier. Denise swallowed. So you are just going to go? Casey did not answer. Sloane stepped closer, voice thin with triumph. Director, this is unlawful. This nurse is unstable. She is clearly involved in something dangerous. Hargrove's gaze cut to him. Dr. Sloane, you are done speaking for the rest of this night. Sloane stiffened. Excuse me. Hargrove's voice stayed calm. You put your hands on staff. You created a hostile environment. You escalated a minor incident into a public humiliation. You will leave this room now. Sloane's face tightened, but he looked at the Navy security men and reconsidered. He turned sharply and walked out, shoes clicking too loud. Keene exhaled shakily. Evelyn, we cannot allow this. Hargrove's eyes stayed on Casey. Nurse Morgan, are you in danger? Casey met her gaze. No. Hargrove did not look convinced. Is the commander telling the truth about an attempt on his life? Casey's throat tightened. I do not know. Rourke's voice cut in calm. She knows enough. Casey's eyes snapped to him. Do not. Rourke held her gaze. You hear radios before they speak. You watch exits before you touch a vial. You tape a dressing like your life depends on it. People like you do not come from nowhere. Hargrove's expression shifted again, now fully alert. Nurse Morgan, what is your real name? The question landed like a hand closing around Casey's throat. Denise's eyes widened. Keene went still. Even the radiology tech paused. Casey forced her face into blank calm. My name is on my badge. Hargrove's eyes did not soften. That is not an answer either. Rourke watched Casey like he was watching someone hold a line under fire. Director, he said, let her keep what she has left. Hargrove's gaze flicked to him. You are asking me to ignore a possible identity issue in my staff. Rourke replied, You are asking her to bleed her life onto your tile. The CT scanner beeped softly. The radiology tech cleared her throat, grateful for the interruption. Scan is complete. We can review images. Rourke nodded. Do it. While the tech moved to her screen, the room loosened by a fraction. Hargrove stepped aside with Denise and Keene, their heads close together, voices too low to catch. Casey stayed near the CT table. Rourke looked up at her eyes, sharp voice low enough to be private. You did not deny it, he said. Casey kept her gaze on the floor. I deny nothing. I confirm nothing. Rourke's mouth twitched, not amused, more like recognition. You are still the same. Casey's fingers tightened around the edge of her scrub pocket. Do not make it personal. It is personal, Rourke said. It has been personal since you kept my teammate breathing when he had no business breathing. Casey's throat constricted. A flash of dust. Heat. A man's eyes wide and wet with terror. A chest cavity open under her hands. Blood slick bright under terrible light. Her own voice steady and absolute, telling someone to breathe as if she could order lungs to obey. She blinked once, hard shutting the memory down. Rourke watched her and spoke again, quieter. I am not dragging you, I am asking. Casey looked at him, and for a moment her mask slipped just enough to show exhaustion, the kind that lived behind bone. Asking with transport on the way is not asking. Rourke did not argue. He held the truth in his eyes and let it sit there. In the hallway beyond the CT room, footsteps approached, heavier, purposeful. The sound of doors opening, radios murmuring. The kind of movement that did not belong to hospital night shift. Hargrove returned expression controlled. Nurse Morgan, if you leave this facility with military transport, you are doing so on your own decision. Do you understand? Casey met her eyes. Yes. Hargrove's jaw tightened. I will require you to sign a statement. Keene opened his mouth. Hargrove shut him down with a glance. Denise stepped closer to Casey. Her voice was rough. Call me. Casey held her gaze. I do not have your number. Denise huffed a bitter laugh. Then I will find you and give it to you. Casey almost smiled. Almost. It did not reach her mouth. The door at the end of the corridor opened. 2 men in civilian jackets appeared, moving with the quiet, predatory grace of operators. No sirens, no announcements, no theatrical urgency. They walked like the outcome had been decided before they arrived. One of them stopped at the doorway, eyes sweeping the room once. His gaze landed on Casey and held for a heartbeat longer than professional courtesy. "Ma'am," he said, respectful, "we are here for transport." Hargrove straightened. "I am Director Hargrove. This is my facility." The operator nodded, once acknowledging a fact that did not change anything. "Yes, ma'am." Keene's voice shook. "You cannot remove her." The operator looked at him politely, like he was speaking to a nervous civilian near a live range. "She is not under arrest. She is requested under consult authority." Hargrove's eyes narrowed. "Requested is not consent." The operator's gaze moved to Casey. He did not pressure her. He simply waited. Denise's eyes stayed on Casey, searching her face for a crack, a plea, a sign. Casey felt the corridor, around her the hospital, the life she had built here out of routine and silence. She felt the thin thread of anonymity she had clung to fraying with every second she stood under these lights. She looked at the CT table where Rourke sat, shoulder-bandaged, hand-wrapped, eyes steady on her. "Casey," Denise said quietly, and there was pain in the word. Casey inhaled, one slow controlled. She turned to Hargrove. "Where is the statement?" Hargrove signaled to Keene, who fumbled a clipboard forward. His hands shook as he held a pen out. Casey took it. Her signature was neat, practiced. The name on the page looked real because she had written it enough times to make it feel like skin. She handed the clipboard back. Keene stared at her as if she had chosen betrayal. "You are leaving your shift." Casey looked at him. "You were going to fire me for a vial." Keene's mouth opened, then closed. Denise stepped forward and touched Casey's arm light, careful, as if afraid Casey might shatter. "You are not alone," Denise said. Casey met her eyes. "Do not follow this." Denise's jaw tightened. "I do not like being told what to do." Casey's voice stayed low. "Then do something useful. Document everything Sloan did." Denise's eyes flared with anger, then steadied into purpose. "Done." The operator at the door stepped aside. "This way, ma'am." Casey walked. The hospital felt different as she moved through it, as if the walls had shifted. Nurses turned to stare. A resident paused with a chart in his hands, eyes wide. The security guard at the main corridor desk sat up straighter without knowing why. As Casey passed Trauma Bay 2, she saw Sloan through the glass. He stood at the workstation, shoulders rigid, staring at his screen like it could rewrite the night. His eyes lifted and met hers for half a second. He looked furious. He looked afraid. He looked like a man watching his certainty break. Casey did not give him anything. No glare, no satisfaction. She kept walking. Outside, the air hit her like a slap, cold and wet. The rain had thinned into mist, the kind that clung to hair and eyelashes. The parking lot lights threw halos in the damp air. The unmarked black SUV waited near the ambulance bay, engine idling, windows dark. The operator opened the rear door. Warmth spilled out. Leather. Clean fabric. A faint scent of metal oiled and maintained. Casey hesitated for one breath, then climbed in. The door shut with a soft, sealed thump that cut the hospital noise away. Rourke slid into the seat beside her a moment later, guided by the combat medic. He moved carefully, jaw tight, refusing help until his body forced him to accept it. When he sat, he exhaled slowly, like he had been holding his breath since the bullet hit. Casey stared out the window as Sentinel Shore Medical Center receded behind glass and rain. The fluorescent glare faded, replaced by streetlights smeared into gold lines across wet asphalt. "You should not have found me," she said, voice quiet, flat. Rourke did not argue. He watched the hospital disappear. "I did not find you," he replied. "You were standing right there." Casey's fingers tightened around the seam of the seat. "That is not what I mean." Rourke's voice stayed calm. "You dropped a vial and still tracked every exit in the room. That is not a nurse reflex." Casey swallowed. The city slid past familiar and suddenly distant. "I am tired," she said, the truth slipping out before she could stop it. Rourke nodded once, as if that was the most human thing she had said all night. "Good," he replied. "That means you are still here." The SUV moved through the rain with engineered silence. Casey kept her eyes on the road ahead, face still breathing measured while the hospital lights fell farther and farther behind them. The SUV carried them out of the hospital's glow and into a different kind of light, the kind that did not soften anything. Street lamps slid past in long, wet streaks. The windshield wipers kept time with a steady mechanical patience, like the vehicle itself refused to acknowledge urgency. Casey sat rigid in the warm leather seat, hands resting on her thighs, eyes forward. She did not look at Rourke. She did not look at the men in the front seat, silhouettes with shoulders that stayed square even when the road curved. Rourke leaned back, breathing shallow on purpose, managing pain like a resource. "You are quiet," he said. Casey kept her gaze on the blurred city outside. "I am working. You are not at the hospital anymore. That does not mean I stopped." Rourke watched her profile. The tiredness in her voice was real, but the edges were controlled. Nothing spilled unless she allowed it. That restraint was familiar to him in a way that made his jaw tighten. The SUV turned off the main road and onto a darker stretch lined with pine and chain link. The rain thinned to mist. The air outside grew colder, and the world began to look less like Virginia Beach and more like a perimeter. A gate came into view under floodlights. 2 armed sentries stood behind concrete barriers. Their posture was not casual, it was practiced. The SUV slowed, tires hissing on wet pavement. The driver lowered the window a few inches. A guard stepped forward, face half shadowed by the brim of his cover. He glanced inside, saw Rourke, and his body changed instantly. Not surprise, not awe, something closer to reflex. "Commander," the guard said. The word came out clean, respectful. Rourke lifted 2 fingers in acknowledgement, too tired for ceremony. The guard's gaze shifted to Casey in the back seat. He looked at her for half a beat longer than necessary, then looked away like his eyes had bumped into something classified. He leaned toward the driver, voice low. "You are cleared. Proceed." The barrier lifted. The SUV rolled through. Casey felt it in her chest as the gate passed behind them. A small, invisible click. She had spent years choosing places where nobody asked the wrong questions. A civilian hospital, a rented apartment, a name that sat lightly on her tongue. This place asked questions without speaking them. They drove past rows of vehicles lined up with military precision, past buildings that looked built for function and surveillance rather than comfort. Floodlights turned the mist into a pale haze. Everything was clean, stark, and awake. Rourke spoke again, quieter. "Nobody stopped you." Casey's eyes moved to the side mirror, then the next intersection, then the nearest lit doorway. They did. Rourke watched her scan, not with words. Casey did not answer. The SUV turned into a lot beside a wide metal building. The sign on the exterior was plain numbers and letters that meant nothing to civilians. The kind of place that did not invite curiosity. The vehicle stopped. One of the men in front stepped out and opened Casey's door. "Ma'am," he said. Casey hesitated for a fraction of a second, then stepped into the cold. The air smelled of wet asphalt and distant salt. Floodlights pressed down on everything, flattening shadows and making faces look sharper. She stood there in wrinkled scrubs among men who looked carved from discipline. Rourke exited on the other side with help he pretended not to need. His shoulder dressing looked clean again, but his posture said pain was still there waiting. As Casey walked with them, she felt eyes on her. Operators moved between buildings. Jackets zipped hands in pockets. Some glanced once and kept walking. Some slowed without meaning to. It was not curiosity. It was recognition that lived in their bodies before it reached their minds. One man's spine straightened as she passed, like his muscles remembered a voice giving orders through rotor wash. Casey kept her face neutral. She hated the way her heart responded. A tightness, a pull, an old alignment she had sworn off. They entered the building and the smell hit her immediately. Rubber mats, industrial disinfectant, cold steel. It was a scent that belonged to training, to repetition, to sweat and discipline and the quiet violence of preparation. Inside was a large hangar-like space with trauma mannequins and training stations laid out in neat rows. Tables held medical kits, tourniquets, gauze, chest seals, airway adjuncts. Whiteboards were covered in tidy diagrams. The environment looked controlled, safe. It looked like the kind of place where people could pretend they were ready. A formation of recruits stood at attention near the far wall. Young, physically imposing faces set in expressions that tried to look bored and confident. Some had that new operator swagger, the kind that says they have survived selection and think that means they have survived reality. Casey's eyes moved over them in quick, precise sweeps. She saw hands clenched, shoulders too high, jaw muscles tight. She saw the ones who held their breath without knowing it. Then she saw the tremor. It was small, almost invisible. A recruit in the second row right side. His fingers vibrated against the seam of his pants in a subtle, involuntary shake. Not fear, exactly. Anticipation mixed with adrenaline and a lack of exposure. The body rehearsing panic. Casey's gaze locked on him for a beat, then moved on. An instructor approached quickly, walking like he was trying to get ahead of the situation before it embarrassed him. Senior Chief Mason Hart. Broad shoulders, weathered face, eyes that were sharp but tired. He wore command presence, but there was something defensive in his posture, as if he had already been told he was about to lose control of his own floor. Commander Hart said to Rourke, then looked at Casey with professional politeness that could not hide his confusion. "Ma'am, we were not briefed on a civilian nurse being brought in like this." Rourke's voice stayed calm. "You are briefed now." Hart nodded, once eyes flicking to Casey again. "With respect, sir, we have a curriculum. Medical training is already built into the pipeline." Casey did not react. She walked past Hart without asking permission, eyes scanning the stations. She opened a kit with her fingertips like it was muscle memory. She checked the contents with quick, practiced motions, not reading labels, just feeling and seeing. Her hands moved without hesitation. Tourniquets, hemostatic gauze, pressure dressings, chest seals, nasopharyngeal airways, decompression needles. Everything was neatly arranged. Everything was clean. Her jaw tightened. Behind her, Hart kept talking, trying to protect his lane. "The recruits have passed trauma modules. We run scenarios twice a week. We evaluate time to tourniquet and airway placement." Casey closed the kit and looked at him for the first time. Her eyes were calm. Her voice was quiet. "Show me." Hart blinked. "Ma'am, show me what they do when it is not tidy," Casey said. "Show me what they do when it is loud, when it is dark, when someone is screaming their name like it is the last sound they will ever hear." The hangar went still. The recruits stared straight ahead, but Casey could feel their attention shift. Hart's posture stiffened. "This is a controlled environment." Casey nodded slowly. "That is the problem." Rourke stood a few feet behind her, hands wrapped, shoulder bandaged, eyes steady. He did not step in. He let Casey hold the air. Hart cleared his throat. "Ma'am, with respect, you are not in the chain of command here." Casey looked at Rourke, then back at Hart. "Then do not pretend you are protecting discipline. You are protecting comfort." A few recruits shifted their weight, tiny movements they tried to hide. Hart's face tightened. "We are not here to be comfortable." Casey's gaze moved to the formation. "Then somebody is lying." She walked toward the recruit, stopping in front of the second row, right side where the tremor lived. She stood close enough that the recruit could smell disinfectant on her scrubs and see the exhaustion under her calm. "What is your name?" she asked. The recruit swallowed. His eyes flicked to Hart, then to Rourke, then back to Casey. "Dylan Shaw, ma'am." Casey nodded once. "Dylan Shaw. Have you ever maintained pressure on a severed artery while someone screamed your name?" Dylan blinked, throat working. "No, ma'am." Casey's voice stayed level. Have you ever had blood spray into your eyes and still kept your hands where they needed to be? No, ma'am. Casey held his gaze. Then stop standing like you are ready. A murmur moved through the formation, tiny, and contained like a breeze hitting tall grass. Hart stepped forward. Ma'am, you cannot speak to them that way. Casey did not look at him. I can. Hart's voice sharpened. You are a civilian. Casey finally turned. Her eyes were steady enough to make Hart's breath catch. You asked for results, she said. You do not get to ask for results and then complain about the cost. Rourke spoke calm but absolute. Senior Chief, stand down. Hart's jaw clenched. He looked at the recruits, then at Casey, then at Rourke. He nodded once, forced. Yes, sir. Casey turned back to the formation. I am not here to be liked, she said. I am here because your commander is alive by accident. That sentence hit harder than shouting. It forced faces to shift. One recruit in the front row narrowed his eyes, confidence curdling into skepticism. He was tall, broad, the kind of man who had never been physically helpless in his life. His jaw worked as if he was chewing on a challenge. Casey saw him immediately. Rourke stepped forward half a pace, addressing the room. Listen, he said, this is Nurse Casey Morgan. He paused. If you are intelligent, you will listen. The skeptical recruit's mouth twitched as if he was holding back a laugh. Casey heard it. She did not need to see it. Her head turned slightly, eyes locking onto him. You have something to say, she asked. The recruit hesitated, then lifted his chin. No offense, ma'am. We are training for combat. You are a nurse. Casey nodded once as if he had given the correct answer in a test. Good, she said. Then you understand this. Combat does not care what you call me. Blood does not care what you call you. Hart shifted uneasy but stayed silent. Casey walked to the nearest station and picked up a tourniquet. She held it up between two fingers. This is not a prop, she said. This is a decision. When you pull it tight, you are deciding that the limb is secondary to the life. If you hesitate, you do not get a second chance. She looked at Dylan Shaw again. His hands were still trembling, tiny and involuntary. Casey's voice stayed calm. Dylan, step out. Dylan swallowed hard and stepped forward, boots thudding softly on the mat. Casey pointed to a trauma mannequin with a simulated leg wound. Put a tourniquet on it. Dylan moved fast, eager to prove he was not what she thought he was. He knelt, hands working, fingers fumbling slightly. He positioned the tourniquet too low, then corrected it, then pulled, but not enough. His jaw clenched. Stop, Casey said quietly. Dylan froze. Casey knelt beside him. She did not touch him yet. She watched his hands. Look at your fingers, she said. Dylan looked down, face reddening. They are shaking, Casey said. Not because you are weak. Because you have never done this when it matters. Your body is rehearsing panic. Dylan's throat worked. I can do it, ma'am. Casey nodded. You can, but not like this. She placed her own hands on the tourniquet, demonstrating. Her fingers moved with a clean economy, no wasted motion. She pulled until the strap bit tight, then tightened again. Her shoulders stayed relaxed. Her breathing stayed steady. Your problem is not strength, she said. It is discipline under panic. She looked at him. Breathe, slow, again. Dylan inhaled, forced it, exhaled. Casey loosened the tourniquet and handed it back to him. Do it again. Dylan did it again, slower. His hands still trembled, but the motion was cleaner. Casey's voice stayed even. Good, again. Behind them, the recruits watched with a different kind of focus now. The cocky one in front row shifted, the certainty in his face thinning. Hart cleared his throat. Ma'am, this is basic. Casey looked up at him, eyes cool. Basic is what saves lives. Ego is what kills them. Hart's mouth tightened. He did not answer. Casey stood and faced the formation. You have been trained to be brave, she said. Bravery is cheap. Anyone can be brave for 10 seconds. The part that matters is the next 10 seconds when your mind starts screaming and your hands want to run. She pointed to the stations. You are going to learn to do the right thing when your body does not want to. A recruit raised his hand almost reflexively, like a schoolroom habit surviving in a room built for violence. Casey's eyes flicked to him. "Speak," she said. The recruit lowered his hand quickly, embarrassed. "Ma'am, we do drills under stress. We have instructors yelling. We have timers." Casey nodded. "Yelling is not stress. A timer is not stress." The room stayed still. Casey looked at Hart. "Do you have training blood?" Hart blinked. "We have simulation fluids." "Get them," Casey said. Hart hesitated. Rourke's gaze moved to him. Hart nodded once and motioned to a junior instructor. A man jogged to a supply cabinet and returned with containers and squeeze bottles. Casey took one, squeezed it onto the mat, letting the red fluid spread in an ugly puddle. The recruits flinched slightly, not from disgust, but from the sudden shift from clean to messy. Casey watched their faces. "See," that she said. "That is where your mind changes. It becomes real for half a second. That is the half second that decides who lives." She handed a bottle to Dylan. "Squeeze it over your gloves." Dylan hesitated, then did it. The red fluid coated his hands. His breathing changed. Casey nodded, satisfied. "Now you feel it." The cocky recruit stepped forward, suddenly voice sharp. "Ma'am, are you going to teach, or are you going to insult us?" Casey turned to him. "Name." The recruit held his chin high. "Cole Bennett." Casey nodded once. "Cole Bennett." She walked closer until she stood just inside his personal space. She did not threaten him. She did not puff up. She stood like a person who had already been in worse rooms. "You want respect," she said quietly. "Earn it by being useful when someone is dying." Cole's eyes narrowed. "I am useful." Casey's voice stayed calm. "Prove it." She turned to Hart. "Give me a scenario. Something real enough to make them lie to themselves." Hart's face tightened, but he nodded, pulling control back through procedure. "Fine. 2 casualties. 1 with arterial bleed. 1 with airway compromise. Time starts when I say." Casey nodded. "Good." Hart raised his voice to the formation. "Teams of 2. Move." The recruits broke formation fast, rushing to stations, grabbing gear, talking over each other in clipped, confident phrases. The hangar filled with movement. Boots on mats, Velcro ripping, plastic packaging tearing. Casey watched without speaking for a moment. She watched how they grabbed equipment, how they clustered, how they spoke. She listened to their confidence. It sounded polished. It sounded like rehearsal. Hart called scenario begins. Immediately, 2 recruits began shouting scripted lines pretending to be casualties. One clutched his leg, yelling. Another gagged and coughed, acting like he could not breathe. The drama was exaggerated, and the recruit smiled at it, half amused, half engaged. Casey's eyes narrowed. She stepped forward and cut the noise with a single, quiet sentence. "Stop acting," she said. The room stalled. Hart frowned. "Ma'am, role play is part of the training." Casey looked at him. "No, this is theater. Theater makes you feel brave. It does not make you competent." Cole Bennett scoffed under his breath. "We are doing what you asked." Casey turned to him. "You are doing what makes you look good." Cole's jaw tightened. "Then show us." Casey nodded once. "Fine." She walked to the casualty station and pointed to Dylan. "You, come here." Dylan stepped forward, hand still stained, red face, serious now. Casey looked at the group around the leg wound. "Your tourniquet placement is wrong," she said, pointing. "Too low. You are saving fabric, not a life." The recruit stammered. "Ma'am, we were taught 2 inches above the wound." Casey's eyes held him. "You were taught a sentence. You were not taught a brain. If you cannot see the wound track, you go high and tight." Hart stiffened. "That is not always." Casey cut her eyes to him. He stopped. Casey knelt and demonstrated fast. Tourniquet high. Tighten. Twist the windlass until it would hurt a living person. Secure it. Then she looked at Dylan. "Your turn. High and tight." Dylan moved, hands trembling less now, movements cleaner. He tightened until his shoulders tensed, then tightened again. His breathing was hard. Casey nodded once. "Good." She stood and moved to the airway station. A recruit was fumbling with an airway adjunct, hesitating as if afraid to hurt the casualty. Casey's voice stayed calm. You are being gentle with someone who is dying. That is not kindness. The recruit's face reddened. Ma'am, we do not want to cause harm. Casey looked at him. You will cause harm. You are choosing which harm. A sore nose or a dead teammate. The recruit swallowed and inserted the airway more decisively. Casey turned to Hart. Now make it ugly. Hart blinked. Ma'am. Casey's gaze was steady. Turn off half the lights. Hart hesitated, then signaled. The hangar lights dimmed in sections, throwing shadows across the stations. Casey pointed to a speaker system mounted high. Play rotor noise. A junior instructor stared, unsure. Rourke spoke once quiet. Do it. The speaker system came alive with the thump and chop of rotor blades loud enough to make conversation difficult. The sound changed the recruits' faces instantly. Their bodies responded before their minds did. Casey watched. Now you are closer, she said. She turned to Cole Bennett. You wanted to prove you are useful. You lead. Cole's eyes flared. Ma'am. Casey's voice stayed flat. Lead your team through the scenario again. Make decisions. Use your voice. Keep your hand steady. Cole swallowed and moved to his station. He barked orders louder than necessary, trying to dominate the noise. His team scrambled. His fingers fumbled with gauze. He forced them steady with will. Casey watched him closely. She did not interrupt. She let him fight his own panic. Then she stepped in beside him, close enough that he could hear her without shouting. You are loud, she said. Your hands are not calm. Cole's face flushed. I am trying to control the team. You are trying to control how you look, Casey replied. Control the bleeding. Cole snapped, I am controlling it. Casey pointed quick. Your pressure is wrong. You are pressing around the wound because you do not want to touch it. Cole hesitated, then pressed harder directly. His eyes widened slightly. The realism hit him. Casey nodded. There. Cole's breathing was fast. This is different. Casey looked at him. That is the point. Across the room, Dylan Shaw was working the tourniquet with steady hands, now jaw clenched, breathing controlled. The tremor in his fingers had not vanished, but it was contained, forced into a smaller space. Casey moved through the stations like a quiet blade, correcting, without insulting, cutting through performance, demanding discipline. She did not raise her voice above the rotor noise. She used clarity instead. Do not narrate, she told one team. Do the work. Stop asking permission, she told another. Announce what you are doing and do it. Check your buddy, she told a third. You are not alone out there. Hart watched her with a mixture of irritation and reluctant respect. He had spent years building a curriculum that looked good on paper. Casey moved through it like paper could not stop bleeding. Rourke stood at the edge, leaning slightly on a table when pain flared, refusing to sit. His eyes stayed on Casey, and something in his expression looked like a man watching a door open after years of banging on it. The rotor noise continued. The dim light made faces harder. The recruits began sweating, not from physical effort, but from the cognitive strain of staying steady while their bodies wanted to rush. Casey stopped at Dylan's station again. Dylan looked up, eyes red-rimmed from concentration. Better, Casey said. Dylan nodded, breathing hard. My hands still shake. Casey's voice stayed even. They will. Your job is to make the shake irrelevant. Dylan swallowed. How? Casey looked at his hands. You breathe. You anchor your elbows. You choose one task at a time. You do not let the noise decide your pace. Dylan nodded, absorbing it like it mattered more than pride. Cole Bennett finished his scenario and stepped back, chest heaving, face flushed. He looked at Casey, and the defiance in his eyes had changed into something else. Something closer to respect that he did not want to admit. Casey met his gaze. Again, she said. Cole's mouth opened. Then he shut it and nodded once. Hart stepped forward, voice raised to cut through rotor noise. All right, reset. New teams. Casey looked at him. Do not reset the room. Reset the minds. Hart frowned. Ma'am? Casey pointed to the floor where the training blood pooled. Leave it. They need to work in it. They need to step wrong and feel it and keep going. Hart hesitated, then nodded slowly. The recruits moved again. The hangar filled with motion and the sound of Velcro and labored breathing. Casey watched their eyes. The panic was still there. It always would be. The difference was that some of them were learning to hold it instead of letting it hold them. A junior instructor approached Hart and murmured something in his ear. Hart's eyes flicked toward a glassed-in office overlooking the hangar. Casey followed the glance without turning her head. In the office, a man stood watching. He wore civilian clothes, but his posture was military. A tablet was in his hands. His face was blank. Casey felt something tighten under her ribs. Not fear. Recognition of surveillance. Rourke stepped beside her, voice low. Intel. Casey did not look away from the hangar. They are watching me. Rourke's tone stayed calm. They are watching the problem. Casey's eyes narrowed. I am not a problem. Rourke's gaze stayed forward. You are a solution. Solutions get attention. Casey's jaw tightened. She returned to the recruits. She moved to a station where a team was hesitating over a chest seal, arguing. The rotor noise swallowed their words. Their mouths moved anyway, wasting time. Casey leaned in. Stop talking, she said. Seal the hole. They did it, hands clumsy but moving. She nodded once and moved on. Hours passed without anyone calling it hours. The hangar lights stayed harsh. The rotor noise came in bursts. The training blood dried in places and stayed wet in others. The recruit's confidence began to crack in the places where it had been hollow. In its place, something more useful started to form, quiet focus discipline that did not need an audience. When Hart finally called a halt, his voice sounded strained. Break, he ordered. The recruits stepped back, sweat streaking their faces. Some looked shaken. Some looked angry. Some looked relieved. Dylan sat on the edge of a mat, staring at his hands as if he did not recognize them. Cole stood with arms crossed, eyes fixed on the floor, thinking hard. Casey walked to a sink station and washed her hands slowly, red fluid swirling down the drain. She scrubbed like she was removing more than stain. Rourke approached, moving carefully. That was the first time I have seen them actually strain, he said. Casey did not look at him. They are used to passing. Rourke's voice stayed quiet. And you made them work. Casey shut off the water and dried her hands. Work is the easy part. The hard part is staying when it hurts. Rourke watched her face. You stayed. Casey's eyes lifted to him, calm, exhausted. For now. Hart approached posture less defensive now, though pride still held tight in his shoulders. Ma'am, he said, then corrected himself as if the word had weight. Nurse Morgan, I do not agree with your method. Casey looked at him. You do not have to agree. Hart's eyes narrowed. But I cannot argue with what I saw. Casey nodded once. Then stop protecting the curriculum. Protect the men. Hart swallowed. Who are you? Casey's expression did not change. Someone who has seen what happens when people freeze. Hart held her gaze. His voice softened by a fraction. Commander said they told him you were dead. Casey did not answer. Hart's eyes flicked to Rourke, then back. If you are here, someone made a decision. Casey's jaw tightened, yes. Hart nodded slowly as if he understood more than he was allowed to say. He stepped back, giving her space. Dylan Shaw approached next, hesitant, like he was walking toward someone who could hurt him without moving. Ma'am, he said, then stopped unsure. Casey looked at him. Speak. Dylan swallowed. My hands shook. I hated it. Casey nodded. Good. Dylan blinked. Good. Because you noticed, Casey said. Men who do not notice get people killed. Dylan's throat worked. Will it stop? Casey held his gaze. It will change. Dylan nodded, absorbing it. Thank you, ma'am. Casey did not respond with warmth. She responded with honesty. Do not thank me. Do the work. Dylan nodded again and walked away, shoulders slightly straighter. Cole Bennett approached last. He moved like he did not want anyone to see him doing it. He stopped a few feet away. I did not freeze, he said quickly, like an accusation. Casey looked at him. No. Cole's jaw tightened. "So what is your problem with me?" Casey's voice stayed calm. "You think your confidence is armor. It is not, it is noise." Cole's eyes flashed. "Confidence keeps you moving." Casey nodded. "Discipline keeps you alive." Cole stared at her for a long moment. The defiance in his face loosened. Not into submission, into respect that had been earned the hard way. "Yes, ma'am," he said quiet. Casey watched him walk back toward the group and felt something shift in her chest, small but real. Not pride, not belonging. A thin thread of purpose that had been cut for years and was now trying to reconnect. From the glassed-in office above, the intel man tapped something on his tablet eyes, never leaving the hangar floor. The screen reflected faintly in the window rows of text and a file header that Casey could not read from here. Rourke stood beside Casey, voice low. "They will ask to meet you." Casey's eyes stayed on the recruits as they reset gear, slower now, more careful. "I do not meet people." Rourke's gaze was steady. "You are in their building." Casey inhaled, once controlled. She looked at the hangar, at the blood-stained mats, at the medical kits now scattered like real work had happened. She felt the old part of her, the part that hated comfort, the part that did not accept excuses when lives were on the line. She turned back toward the stations. "Line them up again," she said to Hart. Hart blinked, surprised. "Ma'am, they just broke." Casey's voice stayed level. "They are not broken." Hart hesitated, then raised his voice. "Formation, now." The recruits moved fast, less swagger now, more focus. Boots thudded into place. Hands came to seams. Eyes forward. Casey stepped in front of them, the hangar lights hard on her face. Her scrubs still wrinkled, her badge still a borrowed skin. She looked down the line and spoke without volume, forcing them to lean in with attention, rather than being dragged by shouting. "Again," she said, "and this time you will not try to look brave. You will try to be useful." The recruits answered her without a word. Boots shifted. Chins lifted. Hands found their seams as if the smallest motion could restore order to their breathing. Senior Chief Hart's voice cut through the hangar. "Teams, move." This time there was less talking, less performance. Gear came out with quieter hands. Tourniquets were staged where they could be reached without hunting. Gauze was torn open before it was needed. Someone checked the corners of a station without being told, eyes flicking for the first time toward what could go wrong instead of what would look right. Casey watched them settle into positions. She listened to the rotor noise still humming in the speakers, the dimmed lights turning faces into sharper angles. The training blood on the mats had dried into dark streaks and sticky patches. It made the floor imperfect. It made the room honest. Hart called the scenario. A recruit dropped to the mat, clutching his leg and yelling. Another gagged and coughed, hands clawing at his throat. The sound was less theatrical now. The recruits on the teams looked at each other once, quick, then moved. Dylan Shaw went to the leg first. His hands trembled, but the tremor stayed small, contained. He planted his elbows against his thighs to anchor the movement and pulled the tourniquet high without needing Casey's voice to correct him. He tightened until his jaw clenched, then tightened again. He secured the windlass without fumbling. When he looked up, his eyes were wide but focused. Cole Bennett was on the airway. He did not waste time arguing. He positioned the casualty, opened the airway, and inserted the adjunct with a decisiveness that would have looked harsh in a classroom and necessary anywhere else. He called out what he was doing, not to narrate, but to keep his teammate in sync. Casey moved through the stations, not hovering, not rescuing. She corrected with a fingertip point a quiet word, a hand gesture that meant move faster or stop thinking and commit. She watched for the freeze that moment when a man's brain hits a wall and his hands stop trusting themselves. When it happened, it was brief and Casey cut it off like a wire. "Breathe," she told one recruit. "One task." The recruit inhaled and moved. At the end of the run, Hart called time and the team stepped back, chests heaving, eyes bright with adrenaline. Nobody smiled. That was new. Casey let the silence sit. Then she nodded once. "Reset," she said. They ran it again. They ran it again until the rotor noise no longer made shoulders jump, until the dim light stopped turning their faces into panic masks, until the sticky mat under their boots felt normal enough that their brains could ignore it and keep working. When Hart finally cut the speakers, the quiet that returned felt heavy. The recruits stood in place, breathing hard sweat cooling on their necks. Casey looked at Hart. "No speeches," she said. Hart's mouth tightened, but he nodded. The first night ended with no applause and no closure. The recruits filed out in small groups, wiping down equipment, cleaning the stations, moving slower than they had arrived. Dylan stayed behind an extra minute, rewinding a tourniquet and staring at it like it had changed shape. Casey watched him and said nothing. Rourke remained at the edge of the hangar, leaning a hand on a table when pain spiked. He was quieter now, more observer than commander. He kept his eyes on Casey the way a man keeps his eyes on a compass in bad weather. As the last recruit left, Hart walked to Casey and stopped a few feet away, uncertain how to speak to her without slipping into rank. "I do not know what to call you," Hart admitted. Casey gathered used gauze and threw it away. "Call me when someone is bleeding." Hart exhaled almost a laugh. "Fair." He hesitated. "You're staying for how long?" Casey's eyes lifted to his. 1 week. Hart nodded slowly. "Then we will work." He turned to go, then paused. "They will ask questions." Casey did not look surprised. They always do. Hart held her gaze for a second longer, then left. Casey stayed in the hangar after everyone was gone, wiping down a station as if cleaning could scrub sound out of her skull. Her scrubs smelled faintly of disinfectant and training blood. Her hands moved automatically. In the reflective surface of a cabinet, she saw the glassed-in office above. The intel man was still there, a dark shape watching tablet in hand. Casey did not look up. She finished cleaning, turned off a light bank, and walked out into the floodlit cold. The base did not sleep. It shifted. Vehicles moved in quiet patterns. Boots crossed pavement. Radios murmured. Somewhere in the distance, a helicopter idled, the sound low and distant like thunder held back. Casey was escorted to a small room in a building that smelled like coffee and old paperwork. A cot with tight sheets. A desk bolted to the floor. A small window that did not open. The kind of room designed for temporary stays and controlled exits. She set her hospital bag down and stood still for a moment, listening. No sirens, no hospital alarms, just base quiet. Her phone buzzed. Unknown number again. This time she answered. Denise's voice came through low and strained. "You left like you were walking into a storm." Casey closed her eyes briefly. "I did not want to bring it home." Denise exhaled, too late. Casey sat on the edge of the cot, shoulders tight. "Is he still alive?" Denise knew who she meant. "Commander is stable. Radiology said the graze was clean. Hand has a fracture." They splinted it. Casey's breathing eased by a fraction. Denise continued, voice sharper now. "Sloan is losing his mind." Casey's gaze fixed on the bolted desk. "What did he do?" "He tried to write you up for contamination and insubordination," Denise said. Director Hargrove shut him down. HR pulled footage. Casey did not react outwardly, but her fingers tightened on the edge of the cot. Denise's voice softened. "They saw him grab you." Casey swallowed. "Then it is documented." "It is," Denise said. Keene is sweating through his suit. Hargrove is furious. They are talking about an investigation. Casey stared at the wall. The base room felt too quiet for this kind of conversation. "Do not let them turn it into gossip," Denise snorted. "This place runs on gossip, but I can steer it." A beat of silence. Denise's voice lowered. "Who are you?" Casey's jaw tightened. "I'm tired." Denise let the answer stand. "Call me if you need anything." Casey's throat tightened. "I do not have your number." Denise laughed, rough. "I am calling you." Casey almost smiled again, a small ghost of an expression. "Thank you." Denise's voice steadied. "Do not disappear on me." Casey stared at the desk. "I will not." She ended the call and sat still, listening to her own breathing. She did not sleep much that night. The next morning the hangar smelled the same, but the recruits did not. They arrived quieter. They checked their kits without being told. They lined up on time. Hart stood at the front with a clipboard, eyes sharper now, less defensive. Rourke watched from a chair today, shoulder-braced, hand-splinted jaw set in stubbornness. Casey stepped in front of the formation and spoke with the same calm, the same lack of theater. "Gear," she said. They opened kits and laid out items in order of use. "Hands," she said. They put on gloves. "Breathing," she said. They inhaled. Some did it wrong at first, too fast. Casey corrected them without raising her voice. "Slow," she said. "If you cannot control your breath, you cannot control your hands." Hart watched, then started moving through the line mirroring Casey's corrections. He was learning her cadence, how to reinforce without shouting. They ran scenarios. Not just bleeding, but confusion. Not just one casualty, but two. Not just clean wounds, but hidden ones. Casey added noise, then removed it. She made them work in silence. She made them work while someone screamed. She made them work while someone stayed unnervingly quiet, the kind of quiet that makes you more afraid than shouting. She watched the recruits' faces for the moment their eyes went empty. When she saw it, she stepped in close and gave them something to hold. Name the task, she would say. Say it out loud. The recruit would whisper tourniquet or seal or airway. Casey would nod once. Do that, nothing else. Dylan Shaw's tremor shrank day by day. It did not vanish. It became a background noise he could work around. Cole Bennett stopped trying to look like the loudest man in the room and started trying to be the clearest. When he spoke now, it was less ego and more instruction. His hands still fumbled under pressure, but he caught himself faster, corrected faster. On the third day, Casey watched him hesitate with gauze eyes flicking like he was searching for approval. Casey stepped in beside him. "No permission," she said. Cole swallowed. "Yes, ma'am." He pressed the gauze into place hard. The casualty screamed. Cole flinched, then held jaw clenched, breathing forced slow through his nose. Casey did not praise him. She just nodded once and moved on. Later, Hart approached Casey near the sink station where she washed her hands between runs. "I want to adjust the curriculum," he said quietly. Casey dried her hands. "Do it." Hart hesitated. "It will make people uncomfortable." Casey's eyes lifted. "Good." Hart's mouth tightened. The base does not like outsiders changing things. Casey's voice stayed flat. "Then call me something else." Hart studied her. "They will still ask who you are." Casey met his gaze. "Let them ask." That afternoon, the intel man came down from the office. He did not approach with threat. He approached with a polite caution that still felt like a cage. He stopped a few feet away and introduced himself. "My name is Aaron Pike, Naval Intelligence." Casey did not offer her hand. "Casey Morgan." Pike's eyes flicked to her badge, then back. He had the look of a man who could hold two truths at once and never show either on his face. "I am not here to interrogate you," Pike said. Casey's expression did not change. "Then do not." Pike nodded slightly, accepting the boundary. Commander Rourke filed an incident report. He says you recognized an incoming security detail before anyone else did. Casey looked past him at the training floor. "I heard boots." Pike's eyes stayed steady. "You also replaced a dressing in radiology with skill that suggests extensive trauma experience." Casey's gaze returned to him. "I am a nurse." Pike held the silence for a moment. "I have a file," he said. Casey did not move. "I do not want it." Pike nodded once, not surprised. "It is flagged as disputed. It was closed years ago. It should not be accessible without special authorization." Casey's jaw tightened, and yet it is. Pike's voice stayed calm. Someone reopened it. Casey felt the cold settle under her ribs again. The same cold she had felt in the hospital corridor when the transport arrived. "Why are you telling me?" Pike looked at her carefully. "Because there was an attempt on the commander's life and because the pattern touches a unit that has been treated like a ghost." Casey's eyes narrowed. "Do not say it." Pike's gaze did not waver. "I did not." A beat. Pike continued quieter. I can give you options. Paperwork, legal coverage, restrictions on cameras, housing under a protected status. Casey's expression stayed flat. I did not ask for any of that. Pike nodded. No, but you are here. That changes your risk profile. Casey stared at him. Do not talk about me like I am equipment. Pike's face stayed neutral, but his voice softened by a fraction. Then tell me what you want. Casey did not answer immediately. She looked at the recruits. Dylan was resetting a station with careful hands. Cole was checking his teammates' gear without being told. Hart was speaking quietly to a junior instructor, pointing to a whiteboard, already editing language. Casey turned back to Pike. No cameras. Pike nodded. Agreed. No public name, Casey added. Pike nodded again. Agreed. And no one touches my hospital. Casey said, voice lower, harder. Not my staff, not my director, not the nurses who tried to help me. Pike held her gaze. Understood. Casey's eyes stayed sharp. And I do not want recruits told a story about me. Pike's mouth tightened. They will talk anyway. Casey's voice stayed flat. Then make sure they talk about the work. Pike nodded. I can do that. He hesitated, then offered, if you want to see the file, it will be in my office. Casey did not move. No. Pike studied her for a beat longer, then stepped back. If you change your mind, you know where I am. He walked away without looking back. Rourke watched from the chair near the wall. When Pike left, Rourke pushed himself up with his uninjured arm and walked to Casey, moving carefully. You did not take it, Rourke said. Casey's gaze stayed on the training floor. I do not collect ghosts. Rourke's voice was quiet. You are not a ghost. Casey finally looked at him. In this place that is not a compliment. Rourke held her gaze. It is the truth. Casey's jaw tightened. Truth gets people killed. Rourke's expression did not change, but his eyes softened. It also keeps people alive. Casey looked away first. The week moved like that. Work layered over tension. Scenarios built into harder ones. Recruits began to stop trying to impress and started trying to perform. When they failed, they did not laugh it off. They reset and tried again. On the 5th day, Hart approached Casey with a small notebook in his hand. I wrote down your corrections, he said. Casey glanced at it. Good. Hart hesitated. Would you review them? Casey took the notebook, flipped through pages, then handed it back. Remove every sentence that sounds like a slogan. Hart blinked. Ma'am. Casey's eyes stayed steady. If it sounds like a poster, it will evaporate under stress. Hart nodded slowly and walked away, already crossing out lines. On the 6th day, Dylan Shaw froze for the first time in 2 days. It happened in the middle of a multi-casualty run. A casualty screamed. Another casualty went silent. Dylan's eyes widened and his hand stopped moving. Casey stepped in close and put her voice in his ear low enough that only he heard it. Name the task, she said. Dylan's throat worked. Tourniquet, he whispered. Casey nodded. Do that. Dylan's hands moved again. Trembling, but moving. He tightened until his arms shook, then secured the windlass. After the run, Dylan stood in front of Casey, breathing hard shame in his eyes. I froze, he said. Casey's voice stayed calm. Yes. Dylan swallowed. I thought it was gone. Casey held his gaze. It comes back. You do not get rid of it. You get better at catching it. Dylan nodded, eyes wet, but steady. Yes, ma'am. Cole Bennett watched that exchange from a few feet away, silent. Later, he approached Casey with his chin less high than usual. I did not freeze, he said quietly. Casey looked at him. No. Cole hesitated, then admitted, but I wanted to talk too much. Casey's eyes narrowed slightly, approving without saying it. Talking is a drug. Cole nodded once, grim. I will watch it. Casey said you will and moved on. On the 7th day, Hart ran a full evaluation scenario. Lights dim, rotor noise, training blood, multiple casualties, conflicting instructions. A man yelling that his friend was dying and that nobody was helping him fast enough. The recruits moved with a new kind of discipline. Not perfect, but real. They called out tasks, They checked each other's hands. They corrected each other without turning it into a fight. They kept their breathing slower. When someone hesitated, another teammate pulled him back into motion with a clear instruction. Casey walked the line and watched. Rourke stood at the edge now, shoulders still bandaged, hand still wrapped, eyes fixed on the floor, as if seeing two timelines at once. One where men froze. One where they did not. At the end of the run, Hart called time, and the recruit stepped back, panting. The hangar went quiet. The rotor noise shut off. The lights came up. The blood on the mats looked uglier under full brightness. Hart looked at Casey. He waited as if he needed her verdict to make the week real. Casey stepped forward and faced the recruits. She did not smile. She did not perform. She said again tomorrow. A few recruits blinked. Hart's eyebrows lifted. Casey continued, voice calm. Not because you failed, because repetition is the only thing that holds when everything else slips. Hart looked like he wanted to argue, then did not. He nodded once. The recruit stood a little straighter. Dylan swallowed, then nodded. Cole nodded too, not proud, just committed. After the recruits were dismissed, Hart approached Casey again, quieter. You said 1 week. Casey met his gaze. I did. Hart hesitated. Then you are leaving. Casey's eyes shifted toward the door, then back, a small automatic scan she did not bother hiding anymore. I am not sure. Hart nodded slowly as if that uncertainty was an answer. Rourke walked up beside Casey, moving carefully, pain still present, but managed. He held a folder in his uninjured hand. He offered it to her without pushing it into her space. Casey looked at it, then at him. What is that? Rourke's voice was quiet. Ballistics. Witness statements. A timeline. The attempt on my life is not a rumor. Casey did not take the folder. Rourke did not insist. He held it at the same distance, patient. Casey stared at the folder, then at the hangar floor. The recruits' voices echoed faintly from outside, laughing softly, now the sound relieved and tired. She had not heard them laugh like that earlier in the week. Casey's voice came out low. I am not going back to war. Rourke nodded once. I am not asking you to. Casey's eyes narrowed. You are asking me to stand near it. Rourke held her gaze. I am asking you to teach. Casey's throat tightened. Teaching makes me visible. Rourke's expression softened. You are already visible. Casey exhaled slowly through her nose. She looked toward the office above where Pike had watched. The window was dark now. Casey finally reached out and took the folder. Not opening it, just taking it. Rourke's shoulders eased by a fraction. Casey's voice stayed flat. No cameras, no press, no stories. Rourke nodded. Done. And my hospital stays out of this, Casey added. Rourke's eyes stayed steady. It will. Casey held the folder against her chest for a moment, then lowered it. Denise's voice sounded in her mind rough and loyal. Document everything Sloan did. Casey looked at Rourke. What happened to the surgeon? Rourke's expression did not change. That is your hospital's issue. Casey nodded once, accepting the boundary. A phone buzzed in Rourke's pocket. He pulled it out awkwardly with his wrapped hand and glanced at the screen. He did not show it to Casey. His jaw tightened slightly. He put the phone away. Casey watched him. Is it about me? Rourke met her gaze. It is about the situation. Casey did not press. Pressing was how you lost control. She opened the folder at last, just enough to see the top page. Diagrams. Measurements. A small photo printed in the corner, grainy and clinical. A mark on fabric. A line drawn. It made the attempted shot look like math. That was worse than a story. Casey closed the folder again. Her hands stayed steady, but her chest felt tight. Rourke watched her. You knew, he said, quietly. Casey's eyes lifted. I suspected. Rourke nodded once. Then you understand why I brought you. Casey's voice was low. I understand why you wanted to. Rourke's gaze held hers. And why I needed to. Casey looked away, first toward the hangar door, where recruits had exited. The floodlights outside turned the mist into pale smoke. She could see their silhouettes crossing the yard, moving with tired discipline. Casey's voice came out quiet. 1 week, she said again. Rourke's mouth twitched. Not a smile, something closer to relief. That is all I asked. Casey stared at the yard. Do not make it sound like you are doing me a favor. Rourke nodded. I am not. They stood in the hangar with the smell of disinfectant and sweat and training blood with the week's work still clinging to the air. Casey finally turned to Hart. Tomorrow, she said. Hart nodded almost solemn. Yes, ma'am. Casey looked at Rourke one more time, then gave a small, deliberate nod. Outside, the floodlights hummed. Boots crossed wet pavement. The base kept breathing. In a quiet office down another corridor, Aaron Pike sat at a desk with the folder open in front of him. A screen glowed in the dim light. He typed a short message, then paused for half a second before sending it, eyes narrowing as if measuring the weight of the words. The message left his screen and vanished into the system. She is alive. She is training them.